So welcome, dear viewers, and you are most welcome to my YouTube channel, the YouTube channel of Mugisha Thomas. And on this platform, as I had mentioned to you before, is that we are going to share much into the health sector, much into our spirituality, much into some philosophical ideologies, if there will be some. And today I come to you and I come to say something small about home visits. How are these home visits integrated in our healthcare? And how are these home visits of any importance to our clients, our patients, while they undergo treatment, while we look at having a better and a good prognosis or outcome of their health-seeking behaviors and their health. Remember that our aim is one, that they may have quality health, that they may be better physically, socially, economically, and that is a comprehensive, a holistic management of what health might be. So let me take you through what home visits are, and of what relevance is it to our clients. Majorly, I'm speaking in the light of care for persons living with HIV. As of present, if for those who have not known my identity, I'm Thomas Mugisha, a medical clinic officer, and taking charge of the HIV clinic or the ART clinic in Chamliwa Health Center for Masaka Diocese, Uganda. So, what are home visits? It is a process. It's a process where a health professional leaves the center of care, that's the hospital, and goes to meet the client, goes to meet the patient in their residence, in their homes, with the hope that can diagnose more health conditions around the patient's home and be able to give a better remedy for those conditions. So this is what we are trying to say, that the necessary health services can even be provided in that kind of a visit when in the home of the client, in the home of the patient. Very good. So look at our HIV clients. These are clients that come almost every month. Now, given the costs of transport, given the costs of, these are persons who are doing their own small income generating activities, we wouldn't want to burden them, asking them to come every month. Come every month. It is tiresome. And sometimes it can even be stigmatizing, because every day you are working, for instance, and you have to leave job and you go to hospital. I mean, co-workers will say, what are you going for? I'm going for my drugs. And what are those drugs? HIV drugs. So to avoid that, we can give them a refill of 3 months, we can give them 6 months, and these drugs, imagine 6 months, our client is with the drugs. This client needs to be visited to increase the rapport, the relationship between this health worker and the client. And it is that which shows a sign of love that the health worker shows to this client. So we want to see of what importance are really these home visitations in respect to our care with our persons living with HIV. So in Uganda, what is happening? Are home visits of anyhow a practice in our current realities? It's true, Uganda, we have these community health workers that we have given a name, village health team members. But what is the level of education of these persons? And who are these that qualify to be VHTs? In most cases, these are good volunteers, people of goodwill in the villages that are willing to give some additional support to help their fellow brothers and sisters, and which is very good. However, in this presentation, I'm trying to say, could health workers who leave the hospitals be able to come to communities, and these communities that they try to amalgamate, they try to mix their effort with that of VHTs, aiming at helping our clients, aiming at helping our people live better standards in as far as health is concerned. So this is what we are looking at. A study has been made, and it's true that these VHTs have helped boost our health-seeking behaviors. They are able to encourage these persons, for instance, mothers, maternity cases, that they are able to say, go to hospital and be able to deliver your health baby in that place. You baby. Now, could we look at what are the major importance or the significance of us reaching out to our clients in their homes and be able to visit them? very important is that we are able to predict the future problems that may come along the way, the opportunistic infections that are likely given the environment in which our clients are living in. And should we diagnose, identify these problems, then we are able to give a remedy that will prevent than us waiting for the disease to come and then we are to cure. Prevention is better than cure. This is some slogan that we have commonly used. And number two, we are able to identify, to study the environment and see the cleanliness of the home. In most cases, these are drugs that we have given for a long time, 6-month treatment, and they're taken once in a day. In 6 months, those are about 180 tablets. How is the storage of these tablets that we have given?